Intravenous, IV, cannulas, also known as IV catheters or IV lines, are medical devices used to access a patient's veins for the purpose of delivering fluids, medications, blood products, or other treatments directly into the bloodstream. They are an essential part of medical care, commonly used in hospitals, clinics, emergency rooms, and various healthcare settings. Here are more details about IV cannulas. Purpose: IV cannulas are primarily used to administer fluids to maintain hydration or correct imbalances, administer medications, including antibiotics, pain relievers, and chemotherapy drugs, administer blood products such as blood transfusions or platelet infusions, deliver nutrients and electrolytes directly into the bloodstream in cases of malnutrition, perform diagnostic tests that require access to the vascular system, such as drawing blood samples. Components: IV cannulas typically consist of the following components. Catheter: the hollow, flexible tube that is inserted into the vein. Hub or connector: the part of the cannula to which IV tubing or syringes are attached. Wings: small, flat extensions on either side of the hub that allow for secure fixation and easier handling. Needle or stylet: a sharp, removable needle used during insertion to puncture the skin and access the vein. Once the catheter is in place, the needle is removed, leaving only the catheter. Insertion: inserting an IV cannula requires a healthcare provider to select an appropriate vein, typically in the arm or hand, clean the area, and use the needle to puncture the skin and enter the vein. Once the catheter is in place, the needle is withdrawn, and the catheter remains securely within the vein. The wings on the hub are then taped down to hold the catheter in position. Size and gauge: IV cannulas come in various sizes and gauges, diameters. The choice of size depends on factors such as the patient's age, medical condition, and the intended use. Smaller gauges, e.g., 24G, are thinner and used for delicate veins, while larger gauges, e.g., 14G, are thicker and used for rapid fluid administration. 24 gauge, 24G, color, yellow flow rate, 20 ml per minute for blood uses, used in neonates and children. 22 gauge, 22G, color, blue description, slightly thicker than 24G, commonly used for adult patients for a wide range of fluids and medications. 20 gauge, 20G, cannula size 20G, mostly used cannula type in clinical settings. Color, pink flow rate, 1.9 L per hour for blood, 3.2 L per hour for plasma, and 2.9 L per hour for crystalloids uses. Blood and IV fluids transfusions description: a versatile size used for various applications, including hydration, medications, and blood transfusions. 18 gauge, 18G, color, green description, larger diameter, suitable for rapid fluid administration or when thicker fluids or blood products need to be infused. 16 gauge, 16G, color, gray description, even larger than 18G, used for rapid infusion of large volumes of fluids or blood products. Less commonly used in routine situations. 14 gauge, 14G, color, orange description, the largest commonly used IV cannula size, reserved for special situations where rapid and high-volume fluid administration is required, such as trauma or surgery. Sterility: IV cannulas are sterile to prevent infection. They are usually individually packaged and opened only when needed for a medical procedure. Maintenance: healthcare providers must regularly assess the IV site for signs of complications such as infection, infiltration, leakage of fluids into surrounding tissues, or phlebitis, inflammation of the vein. Duration of use: the duration of IV cannula use varies depending on the patient's needs. Some may be used for short-term purposes, a few hours, while others can remain in place for several days. Removal: when the IV cannula is no longer needed, it is carefully removed by healthcare professionals to minimize the risk of complications. Safety considerations: proper training and adherence to strict protocols are essential to ensure safe and aseptic insertion and care of IV cannulas to prevent complications. IV cannulas are crucial for providing essential medical treatments and therapies to patients, and their proper use and care are fundamental aspects of healthcare delivery.